This lecture is going to go over anticholinergics, also known as cholinergic antagonists or parasympatholytics, and it starts on page 215. So anticholinergics, how do they work? They work by inhibiting the action of acetylcholine by occupying acetylcholine receptors. So in this diagram, it shows you the drug going in and blocking the acetylcholine from attaching to the receptor. So again, anticholinergic, a cholinergic antagonist, or a cholinergic blocker. The effects of cholinergic antagonists or anticholinergics. So you know, because of the CHOL, the chol, that we're talking about the parasympathetic system. Then you have to remember, as an agonist or an antagonist, here we're talking about a cholinergic antagonist, an anticholinergic. So that would be something that's blocking that normal parasympathetic response. In that situation, what the medication is going to produce is signs and symptoms that align more with the sympathetic nervous system. So heart, we would see increased heart rate, lungs, bronchodilation, GI, relaxed, smooth muscle tone, right? Because a cholinergic antagonist is going to turn off that rest and digest. And because that's being turned off, that fight or flight response is what's going to be seen in the patient. Genitourinary, relaxed detrusor muscle, increased sphincter constriction. So bathroom breaks are not going to be a priority, right? We'll worry about urinary retention, constipation. Eyes, dilated pupils. Glands, decreased salivation and perspiration. CNS, decreased tremors and rigidity of muscles. So the first anticholinergic we're going to talk about is atropine. Atropine is your prototype drug on page 217. When I think of atropine, I think of the T as, when I write it, I draw the T as an upward arrow and the P as a downward arrow. And that reminds me that with atropine, something's increasing and something's decreasing. And you look here under action, what's increasing is the heart rate. So atropine can be given to a patient who has symptomatic bradycardia. So they have a low heart rate and they're feeling symptoms because of it. What decreases, the P with the downward arrow, I would write secretions or salivation. With atropine, there's decreased GI motility, spasms, peristalsis, salivary, and gastric secretions. So the decreased secretions or salivation is important as a pre-op med. Atropine will be given to dry up all the secretions to decrease the risk for aspiration. Side effects, again, if I'm thinking about the classification, anticholinergic, I'm blocking my parasympathetic rest and digest. So that means I'm going to see more of a sympathetic nervous system response, more of a fight or flight. Tachycardia, right? Not being surprising. Constipation or urinary retention, not being surprising. Photophobia, blurred vision, all related to how the anticholinergic affects pupils. Dry mouth and skin, decreased sweating. Then finally, palpitations and dysrhythmia. At the bottom, it says contraindicated in glaucoma. When I think of anticholinergics, there's two things that you should come to mind automatically, and it's one, that they're drying, so there's going to be decreased secretions and salivation. They're drying. And two, no glaucoma. Anticholinergics are contraindicated in patients with glaucoma. And to review again, the reason why anticholinergics are contraindicated with glaucoma is because anticholinergics can cause mydriasis, which is the dilation of the pupils. And if you remember, dilation of pupil is bad for glaucoma. And while I say with anticholinergics to focus on drying and no glaucoma, please review table 16.3 on page 216 that lists the effects of anticholinergics on all the different body systems, whether it's cardiovascular, urinary, central nervous system. Be familiar with those. So atropine, nursing interventions, obviously monitor vital signs, urine output, and bowel sounds. So again, with atropine, would I expect my urine output to increase or decrease? Would I expect my peristalsis to increase or decrease? And if you said decrease because it's an anticholinergic, that would be correct, right? Because we're going to see more of the fight or flight type responses from the body. Monitor safety, bed rails, driving motor vehicles. We worry about just those safety concerns with the patient. Providing mouth care, eye drops, so hydrating the patient, avoiding hot environments, and wearing sunglasses in bright light. And we're going to go over the nursing process box for atropine in just a second. Before we get to that, we're going to talk about benzotropine. This top medication listed there, that's the only one, the only anti-Parkinson, anticholinergic drug I want you to know about. So benzotropine is our prototype anti-Parkinsonism anticholinergic, and it's used to treat Parkinson's disease. It works as an anticholinergic to decrease involuntary movement, tremors, and muscle rigidity that are seen in our Parkinson's patients. And again, the side effects, when you think about anticholinergics, there should be nothing new or unfamiliar to you that's listed there. I'm going to let you look at those on your own. And again, the benzotropine, which is an anticholinergic used for Parkinson's disease, or pseudoparkinsonism, which would be when a patient may exhibit Parkinson's disease-like signs and symptoms, maybe because of medications they're taking. And so to deal with those side effects or adverse effects of medications, they could get on an anti-Parkinson's medication. So your nursing process box for anticholinergic, specifically atropine, starts on page 217 and goes over to 218. Look over that and mark down, jot down, pause the video, jot down what you think would be most worthwhile to note about atropine. So under assessment, obviously we want to get baseline vitals for future comparison. We want to check or assess urine output because we're worried about urinary retention. Check the patient's medical history. Again, we're especially concerned with the patient who has glaucoma, any obstructive GI disorders, paralytic ileus, or urinary retention. Also want to get a drug history for the patient. Under urinary diagnosis, things we're going to watch for: urinary retention because of the atropine administration. We're going to monitor the patient's oral mucous membranes because those oral secretions and salivation are going to decrease. Patients at an increased risk for injury and constipation. Under planning, the two big ones again is 1, patient secretions will decrease before surgery, or 2, heart rate will increase in the patient who has symptomatic bradycardia. Okay. Under nursing interventions and patient teaching, we want to monitor patient vital signs and report tachycardia occurs, monitor fluid, I's and O's, want to assess bowel sounds, watch for constipation, and encourage ingestion of foods that are high in fiber and the intake of adequate amounts of fluids, and exercise if possible to help prevent constipation. Bed alarms for patients who are confused. Atropine can cause CNS stimulation such as excitement or confusion or drowsiness. Mouth care because those oral secretions are going to decrease and cause dryness. Under patient teaching, I want to tell patients to avoid hot environments. There's going to be a diminished amount of sweat in the patient who's taken an anticholinergic. Teach patients with narrow angle glaucoma to avoid atropine-like drugs. And anticholinergics again cause mydriasis and increase intraocular pressure, which is contraindicated for patients with glaucoma. Instruct patients not to drive a motor vehicle or participate in activities that may require alertness. Under side effects, again, dry mouth, decreased urination, constipation are the big ones. We already talked about addressing constipation. Instruct the patient to urinate before taking an anticholinergic because urinary retention can be a problem. And then for the drying of the mouth, suggest the patient use hard candy, ice chips, or chewing gum, and maintain an effective oral hygiene if the patient's mouth is dry because anticholinergics decrease salivation. Also, eye drops can be used to moisten dry eyes. Before we move on, if you look at page 219 in your purple chart of anticholinergics, you have atropine listed. There's a couple other ones I want you to know. If you look at right below atropine, dicyclamine, and then on the next page, the top drug there listed, hycosamine. So dicyclamine and hycosamine, I want you to recognize those medications as anticholinergics, and they're frequently used for patients with gastrointestinal problems. So maybe we have IBS, maybe I have a lot of cramping going on. The provider may prescribe an anticholinergic such as dicyclamine dicyclamine, or hycosamine, which help relax those muscles and slow down the peristalsis to give me some relief from that cramping. Also on that list is your next slide here, scopolamine, which is trying to get it there. Scopolamine is an anticholinergic with antihistamine and antiemetic properties. It's used to treat motion sickness, nausea, and vomiting. The big thing about scopolamine is it's a patch, and as a specific place where you apply it behind your ear, and it stays in place for 3 days. So you apply it and leave it in place. It delivers its dose over 3 days. The side effects associated with it there are not surprising, considering it's an anticholinergic, right? So I'm not going to go through all those. Those should make sense to you by now. And then finally, if you look at page 221, tolterodine tartrate. This is the opposite of the first medication we talked about for this chapter, bethanacol. So bethanacol is your cholinergic agonist, which was used to treat urinary retention, and it stimulated contraction of the bladder so that the patient could urinate. Tolterodine is the opposite. It's an anticholinergic used to decrease urinary frequency, urgency, or incontinence. So it would be used to treat an overactive bladder. So an overactive bladder would be treated with an anticholinergic. Tolterodine, I think of it to help. I can remember the B and the T and the names, and I think of the T. Tolterodine is toning down the amount of times that I have to use the restroom to help try and keep those straight. But again, any sort of little tips that you can make for yourself to keep those straight are helpful. All right, so let's go to the questions. Question 1, read it. We'll read it. You pause it. Try to answer it yourself. A patient has received atropine. It's most important for the nurse to assess the patient for which effect. If you answered C, that's the correct answer. Urinary retention is the highest priority because it's more serious to systemic homeostasis than anxiety, constipation, or dry mouth. Practice question 2. A nurse has just administered atropine to a patient. It's most important for the nurse to assess the patient for the development of B. Tachycardia is the correct patient or answer. Practice question 3. A patient is ordered to receive bethanacol chloride for urinary retention. Which health condition would serve as a contraindication for this medication? If you answered A, asthma, that is the correct answer. Practice question 4. A patient received atropine as a pre-op med 30 minutes ago. The nurse evaluates the med as effective when the patient states, the correct answer is C, my mouth feels dry. 5. A patient is prescribed scopolamine. It is most important for the nurse to assess the patient for a history of, correct answer B, glaucoma. Anticholinergics, no glaucoma. 6. Atropine is most useful in the treatment of which cardiovascular condition? And that's D, sinus bradycardia.